Today I'm going to speak about Resist, the first formula in our lineup of winter support products. Resist was developed in the early 90s by Daniel Weber in response to the outcry of HIV patients and their recurrent infections. It is as relevant today as it was then, possibly to a different patient demographic. It is the best immune formula, I believe, on the Australian market currently. It addresses innate and adaptive immunity. Which kind of patients are you going to give it to, you might ask? It's quite broad. It would be, as I have had this week, an elderly patient, late 70s patient, who is susceptible to everything that runs by him. He is kind of a deficient / rundown kind of patient. He had a lingering cough, unable to move it with anything, and he had a fantastic response in 3 days. So in terms of demographic, it's your elderly patients, your patients who are post-operative, patients who are coming out of long illnesses, patients who are post-viral disorders, chronic fatigue patients, glandular fever patients, people who have a history of recurrent infections and lingering coughs, people who are exposed to small children. It's an adjunct to chemotherapy, very supportive to these patients who are undergoing cytotoxic drug therapy. It benefits gut microbiota, which shapes systemic immunity. It's basically going to support your patient expediting recovery from viral and bacterial infections. It's like your classic rundown patient. Now that could be you, that has been me. I'm sure it's been you at some point. So your classic rundown patient, your patient that is vulnerable for whatever reasons. Maybe they have had too many pregnancies too close together. They may have had, swaying weight gain, weight loss, history of sort of infectious diseases. It's generally patients who are run down. So I would have a look at this formula. We've been using it and prescribing it for more than 25 years. I know many of you have too. If you haven't used Resist yet, please try it. Call me up and tell me what your patients experienced. I'll be back in a couple of days to talk to you about AVAT, the great antiviral formula. Thank you.